This is not a dumb question at all, and I don't have a very smart answer for you. So it's absolutely true. If you take a bunch of women with a C-cup breast with a natural breast, a bunch of women with a C-cup breast with implants, the natural breasts always droop more than the implants. So why does this happen? So this is all my opinion. I don't think there's any studies, someone's gonna correct me, I don't think there's any studies that explain why, but people with larger natural breasts, like a C-cup, D-cup, they tend to develop very quickly in their youth and often have stretch marks. Now, stretch marks are a fracture of the dermis, and when the dermis fractures, the skin is not strong enough and it doesn't support weight, so you tend to see a lot more drooping. The other thing to consider is that women with larger natural breasts, they've had them for longer than women that have implants, right? Because they developed usually in puberty and they've had breasts that size for at least 10 years longer than women who get implants in their 20s or 30s. So the combination of stretch marks, time, often leads to more sagging. And then the last thing is that implants have the benefit of the capsule. So anytime you put a foreign body in your body walls it off with scar tissue, and that's the capsule. Capsule's just think of it as a scar tissue sac that your implant lives in. So if the capsule forms properly, that's a nice little thicker bag of tissue holding the implant up. So it just gives a little bit more support to that weight. So that's the things that I think contribute to a natural breast sagging more than an implant breast. You certainly can have natural breasts that don't sag at all and implanted breasts that sag a lot, but in general, yes, you are absolutely correct.